Memorial Day weekend. I remember it like yesterday. I get a call, he's gasping for air, and the Vanderbilt Air Ambulance Service medevaced him from Tennessee here to Teterboro, right here to our hospital where we fixed him.
One of our local ENT doctors who I knew was nice enough to actually go up with me in case I didn't quite make it up there.
Most doctors in a crisis situation like that Glenn found himself would perform a tracheotomy, which is not wrong, by the way. You establish the airway, you secure the airway, that's a very basic principle, but many people just don't want to have a hole in their neck, and I think that's legitimate, and that's one of our value added here, is that we can manage these cases without cutting a hole in your neck.
It was very intimidating to come to New York City to go so far for medical treatment, and to have surgery in a hospital 1,000 miles from home is scary. Dr. Lebovics made me feel comfortable right away, and I knew that I was in good hands, despite all the people and buildings, and you guys talk funny.
Let me try to explain to you with a model of what I did with Dr. Hatcher. You can see from here, we take these special microlaryngeal scissors and we make cuts right into that scar band, right to where this cartilage is, and I can actually feel it as I'm cutting. And under direct vision, I will then inflate the balloon in the area of the stenosis after the cuts were made and after the steroids have been injected. Unfortunately, with Dr. Hatcher, he had disease in both the subglottic larynx and proximal beginning of his trachea, both the first and second tracheal rings. So when Dr. Hatcher was asleep, paralyzed, we pre-oxygenate his lungs. Something called the functional residual capacity, or the FRC, acts as a reservoir or capacitor to provide oxygen to him.
As soon as I wake up from the anesthesia, I immediately notice that I can breathe much better.
The great thing is a patient like this, such as Dr. Hatcher, he gets to the recovery room and they say, oh my God, I can breathe. And they're smiling, they're happy. I've had patients cry from happiness in the recovery room saying, oh my God, you don't know what you did for me.
It's hard to express how grateful you are to someone that allows you to live and live normally, and realizing that there's maybe no one else out there that could do it to this degree. No one else has reproduced his success.
Ultimately, this is all about one thing: doing the best by people and treating them the way you'd want to be treated if you were a patient.
As a physician myself, I know that it's hard enough just to keep up with what's going on. Dr. Lebovics is one of the few doctors that has actually changed medicine. His procedure has changed the way medicine is practiced, because this is now the accepted way of dealing with subglottic stenosis in Wegener's patients, and that's huge.